So while this is all happening, so much is happening inside your uterus as this little one grows, and obviously there's a lot of hormones that are being released. The very first hormone to be released when this little pregnancy starts to embed in the uterus is called human chorionic gonadotropin, or beta HCG. And as you know, that is the hormone that we will ask you to test on your blood to confirm if you are pregnant. And we usually do 2 tests. So we do one, and then 2 days later or 48 hours later, we do a second one so that we can see that we get a good rise in that level. And that will confirm for us that the pregnancy is growing as we would expect, and hopefully that it's also growing in the right place. Because those are some of the things we check at your first scan. We want to know how many babies are growing, that the pregnancy is in the right place, that it's not an ectopic pregnancy, which means that it's somewhere outside of the uterus itself, and that we can see baby is appropriately grown for its how old we think it is, and that it's got a little heartbeat if it's time for us to see that. Okay, so those are all those important things. So just to say also that those hormones may make you feel a bit sick. Unfortunately, that can be quite common, morning sickness in the first trimester. And if that is the case, there's a few things that we do give you to assist. Ginger is often considered to be a good option. So there are some suckers out there called Preggy Pops you can try. Otherwise, ginger sweets, trying to keep maybe some crackers with you just when you're feeling a little bit queasy. And obviously maybe eating smaller meals through the day as opposed to big, large meals. So those things can help. You might also feel a little bit of congestion that can be quite normal in the first trimester. It is related to the high levels of progesterone that are in your body, which is another hormone that helps us to grow the baby, or helps the baby to grow rather, maintain the pregnancy and early pregnancy. Okay, so those things can make you feel unwell and even a little bit moody, okay, all normal. So we just want nice supportive partners who understand that these things happen. And it's all part of the normal experience of first trimester, okay? Other unusual things you can experience, things like a metallic taste in your mouth, okay? Interesting, but it can happen. Or an increase in saliva production, okay? And again, these things are all normal, nothing to worry about, and often they may even improve after the first trimester as you get further in your pregnancy. Other thing, breast tenderness, totally normal. What I would suggest for that would be wearing something like a nice supportive bra, just to assist with that discomfort. Okay, so all good signs. The other thing to just remember, and we always tell our ladies so you don't panic, but spotting in the first trimester can happen. It doesn't necessarily mean there's anything wrong with your baby or your pregnancy. It can be related to implantation. So when that little embryo burrows into the uterus itself, a little bit of blood may come out, and that's spotting or an irregular or abnormal, let's say, period you might see. That's implantation bleeding. So don't be concerned. Obviously, always a good idea to let us know and come in and so we can check you. But usually, thankfully, nothing to worry about. Okay, so that is our the main stuff to think about first trimester, and obviously we're always available for questions or for assistance if needed. So that's it. Thanks.